Have you ever noticed how hearing the word progression can make your heart race a little, even before you understand what it really means? One of my patients once shared that what unsettled her most was not feeling sick, but feeling unsure about how quickly something might change inside her body. Now I want you to imagine this. You are sitting in a quiet room, listening to a calm explanation that helps your body relax instead of putting it on alert. I am Dr. Evelyn Carter, and for many years I have cared for older adults who want clarity, not urgency. When people hear phrases like timeline or progression, especially connected to a virus, it can sound fast and uncontrollable. From real clinical experience, I can tell you that most worry comes not from what is happening, but from not understanding how the body actually responds over time. The Nipah virus is rare and not something most people encounter in daily life here in the United States. Most seniors are not facing immediate danger. In medicine, progression does not mean sudden decline. It means a sequence that doctors observe carefully, often slowly, and always within context. Headlines rarely explain this. Doctors do. The purpose of this video is gentle and clear. We are not here to rush you or alarm you. We are here to answer a simple question. How does Nipah virus progression actually unfold in the body? And why do physicians describe it so differently from what you might hear in the news? This conversation is about education, not urgency. For today, understanding alone is enough. You do not need to monitor your body constantly or change your routines. Calm awareness supports health far better than fear ever could. When the mind feels steady, the body often follows. If you find this kind of calm, respectful explanation helpful, please take a moment to subscribe, like, and share Senior Health Daily. Your support allows us to continue creating thoughtful health guidance made especially for older adults. In the next part, we will gently walk through how doctors understand progression, timing, and the body's responses, with special care for how these changes look in older adults. We will move slowly, clearly, and always with your peace of mind and focus. Why progression timelines matter more than headlines. As we continue this conversation, I want to gently reset where we place our attention. In real medical practice, doctors do not begin with headlines. We begin with timelines. We look at how the body changes step by step, not how a story sounds in a single moment. This difference is especially important for older adults. Headlines are built to feel urgent. They compress time and remove context. Words like fast, sudden, or rapid appear often because they capture attention. But they rarely explain what those words actually mean inside a living body. I have met many seniors who came to me worried, not because they felt unwell, but because they believed something dangerous could unfold overnight. That fear usually came from misunderstanding progression as speed. In medicine, progression is about sequence, not panic. It describes how changes unfold over time, sometimes slowly, sometimes unevenly, and often differently from one person to another. A timeline helps us see whether the body is adapting, stabilizing, or truly struggling. Without that timeline, isolated sensations can feel much more alarming than they need to be. From my years in clinical care, I have seen how seniors often misinterpret progression. A day of fatigue becomes a sign of decline. A headache becomes a warning of something severe. When these sensations are viewed without context, anxiety fills the gaps. But when we place them on a timeline, something important happens. Patterns become visible. And patterns bring clarity. Doctors ask questions like, when did this begin? How has it changed? And what else was happening at the time? We look at sleep, hydration, stress, and routine. These details matter far more than a single symptom. This is why headlines can never replace medical understanding. They do not know your body, your history, or your rhythm. For older adults, this distinction protects emotional health. When progression is understood as a measured process rather than a race, the nervous system settles. Breathing slows, thoughts become clearer. The body responds better when it does not feel rushed or threatened. It is also important to remember that rare viruses are monitored carefully by medical systems long before they affect daily life. Progression timelines are studied precisely so changes can be recognized early and calmly. Seniors are not expected to track this on their own. That responsibility belongs to trained professionals. Understanding progression as sequence rather than speed allows you to trust your body again. It helps you notice changes without fear and remain grounded in your daily routines. This perspective does not reduce awareness, it refines it. As we move forward, I want you to hold on to this idea. Progression is not about how fast something might happen. It is about how carefully doctors observe what is actually happening. That understanding will guide everything else we talk about together. What progression really means in medical terms. When people hear the word progression, many imagine a straight line moving quickly downward. In real medical practice, progression rarely looks that way. One of my most important roles as a physician has been helping patients understand this difference, because misunderstanding it can create unnecessary fear. Progression simply means change over time. It does not automatically mean worsening, and it certainly does not mean rapid decline. In clinical settings, progression can include improvement, stabilization, pauses, or small fluctuations that settle on their own. Doctors use the word to describe a sequence, not a direction. I often think back to conversations with older patients who worried that noticing a new sensation meant something serious was unfolding. A gentleman once told me he feared his body was failing because he felt weaker for a few days. When we looked more closely, we saw that his sleep had been poor, he had skipped meals, and he had been under emotional strain. Over the following week, with rest and routine restored, his strength returned. That was progression too, but in a reassuring direction. Rapid decline is different. It involves sudden, sustained changes that interfere with basic daily function and do not ease with time or support. In medicine, these situations stand out clearly. They do not hide quietly in mild symptoms. They announce themselves through significant shifts in awareness, mobility, or the ability to care for oneself. Doctors are trained to recognize these patterns quickly. Progression, on the other hand, often unfolds slowly and unevenly. A symptom may appear, fade, and return before settling. Another may never develop at all. This variability is especially true in older adults, whose bodies adapt differently than younger ones. Aging does not make the body less capable. It makes it more complex. That complexity is why doctors rely on observation over time rather than instant conclusions. From a scientific standpoint, the body is always adjusting. Immune responses rise and fall. Energy levels shift. Healing does not follow a strict schedule. When doctors talk about progression, we are observing how the body responds across days and weeks, not minutes or hours. This understanding protects emotional health. When seniors know that progression is not a race, they stop watching their bodies with suspicion. They begin to notice changes calmly without assigning immediate meaning to every sensation. That calm awareness supports better sleep, clearer thinking, and steadier routines. Medical care is designed to support this process. Follow-up visits, monitoring, and communication exist so changes can be understood in context. Seniors are not expected to interpret progression alone or make urgent decisions without guidance. Understanding what progression really means allows you to replace fear with patience. It reminds you that change does not equal danger, and that most bodily shifts are part of a longer, manageable story. This perspective helps you stay grounded in daily life, trusting that careful observation and medical support are already in place to guide you if and when something truly needs attention. Early Nipah virus progression versus common illness. One of the most reassuring things I can offer is perspective. Early signs that worry people about progression often look very similar to what the body experiences during ordinary illness or simple fatigue. Without context, the mind can assume the worst. With context, those same sensations feel far less threatening. In everyday medical practice, early progression signs are often quiet and nonspecific. A person may feel more tired than usual, have a mild headache, or notice a low fever that comes and goes. Muscle aches or a general sense of not feeling quite right are also common. These are the same sensations doctors see with seasonal viruses, disrupted sleep, dehydration, or emotional stress. For older adults, even changes in routine or a few restless nights can produce similar feelings. What matters most is how these sensations behave over time. With common illness or fatigue, symptoms usually improve gradually. Rest helps. Appetite returns. Energy begins to rebuild. The body shows signs of recovery even if it takes a little longer in older age. This pattern is familiar and expected. Early progression related to something more serious tends to look different because it does not settle. Symptoms persist or slowly intensify. Fatigue deepens rather than easing. Fever remains or increases. Mental clarity changes in a way that feels unusual for the person. These differences become clearer when viewed across days rather than moments. From my clinical experience, many seniors worry because they notice fatigue and assume it signals decline. In truth, fatigue is one of the most common complaints in medicine and one of the least specific. It can reflect sleep quality, hydration, emotional strain, or even boredom. Doctors rarely treat fatigue alone as a sign of serious progression without other changes present. Context also includes likelihood. Nipah virus is rare, especially in the United States. When symptoms appear that match common illnesses, doctors always consider the most likely explanations first. This approach protects patients from unnecessary fear and testing. It is also important to remember that aging bodies communicate differently. Recovery may be slower, but it still happens. Ordinary illness may linger a bit longer without meaning something dangerous is unfolding. Patience becomes part of good care. Understanding this distinction helps seniors stay grounded. It allows you to notice how your body feels without immediately assigning fear to those sensations. Awareness does not require alarm. It requires observation with kindness. When early sensations are placed in the context of daily life, routine, and time, reassurance often follows naturally. That reassurance supports emotional balance, which in turn supports physical recovery. This is why doctors emphasize watching patterns, rather than reacting to isolated symptoms. By understanding how early progression compares to ordinary illness, you gain confidence. Confidence allows you to rest, observe, and respond wisely if needed, without letting worry take control of your days. How aging changes the body's response over time. As the body ages, its responses become more nuanced rather than more dangerous. This is something I have watched closely over many years of caring for older adults. Aging does not mean the body loses its ability to respond. It means the response often unfolds more slowly and with subtler signals. Younger bodies tend to react loudly. Fever spikes quickly. Fatigue can arrive suddenly. Pain may be sharp and obvious. Aging bodies often speak in quieter tones. A senior may feel a gradual drop in energy, a mild change in appetite, or a sense that something feels different without being able to point to a single symptom. These changes can feel unsettling simply because they are less dramatic, but subtle does not mean serious. From a clinical perspective, there are clear reasons for this. Metabolism slows with age. Immune responses may take longer to build, which can soften early symptoms rather than intensify them. Inflammation may rise and fall more gently. These shifts reflect adaptation, not failure. The body is conserving energy and responding in a measured way. I often reassure patients that slower progression can actually be protective. When changes unfold gradually, doctors have time to observe patterns, adjust care, and support recovery without urgency. A slower pace allows for thoughtful decision-making rather than rushed conclusions. This is one reason we emphasize timelines in older adults. They give us clarity. Another important factor is experience. Seniors know their bodies well. They notice small differences because they have lived with their bodies for decades. That awareness can sometimes be mistaken for fragility. In reality, it is wisdom. Recognizing a change early does not mean danger is near. It means the body is communicating honestly. It is also true that recovery may take longer with age. Healing does not follow a straight line. Energy may return in stages. Appetite may fluctuate before settling. These patterns are normal and expected. They do not signal that something is worsening. They signal that the body is working through change at its own pace. Emotional state plays a powerful role here. When seniors feel anxious, symptoms often feel heavier and more persistent. When they feel calm and supported, the same symptoms often soften. This is not imagined. Stress hormones influence immune function and perception of discomfort. Calm supports balance. Understanding how aging changes the body's response helps remove unnecessary fear. It allows seniors to observe changes without assuming the worst. It also helps caregivers respond with patience rather than urgency. Both approaches protect dignity. Aging bodies progress differently, but different does not mean dangerous. It means the story unfolds more gently. When that story is read with patience and respect, confidence grows. That confidence supports steadier routines, better sleep, and clearer thinking, which are among the strongest foundations for health in later life. How doctors observe progression calmly and carefully. When physicians observe progression, we do not chase every symptom as it appears. We step back and watch how the whole person is doing over time. This calm, careful approach protects both physical and emotional health, especially for older adults. In clinical practice, isolated symptoms rarely tell the full story. A headache on its own, a restless night, or a day of low energy can happen for many reasons. What matters is how these experiences fit together. Doctors pay attention to timing, consistency, and impact on daily function. We ask when something began, how it has changed, and whether it is affecting the person's ability to live their usual life. Overall function is one of our most important guides. Can the person still prepare meals, move around safely, and stay engaged in familiar activities? Is their thinking clear in ways that are normal for them? Are they sleeping, eating, and interacting in ways that match their usual pattern? These observations tell us far more than any single sensation ever could. Timing helps us see whether the body is adapting or struggling. Many changes improve with rest, hydration, and a return to routine. When improvement appears, even slowly, it suggests the body is responding well. When symptoms persist or deepen over time and begin to interfere with function, that is when we look more closely. This process unfolds over days and weeks, not moments. From my experience, seniors often worry that doctors might miss something if they are not reacting quickly. In reality, careful observation is a form of protection. It prevents unnecessary testing and treatments that can cause stress or side effects without benefit. It also allows physicians to act with confidence when intervention is truly needed. We also consider context, recent illness, changes in medication, emotional stress, and shifts in routine all influence how the body feels. Aging bodies are sensitive to these factors. By understanding the full picture, doctors can distinguish between temporary responses and meaningful progression. Communication is part of this careful approach. Physicians listen not only to what patients say, but how they describe change compared to their usual baseline. When seniors can explain what feels different within the context of their daily life, it gives us valuable information. This partnership supports better decisions. For caregivers, especially those supporting someone with memory changes, this method offers reassurance. You do not need to identify every symptom or interpret every behavior. Observing patterns calmly and sharing them with a healthcare provider is enough. Your insight into daily function is deeply important. Doctors observe progression with patience because the body deserves time to speak clearly. This steady approach reduces fear, supports dignity, and allows care to be guided by understanding rather than urgency, staying informed without creating anxiety. One of the quiet challenges many older adults face today is not a lack of information, but too much of it arriving too quickly. Health news moves fast, often without context, and it can leave the mind feeling unsettled. I have spoken with many seniors who told me they felt more anxious after reading updates, even though nothing had changed in their own bodies. Information overload affects emotional health in very real ways. When the brain is constantly exposed to urgent messages, it stays in a state of alert. This can interfere with sleep, make concentration harder, and heighten normal bodily sensations. A mild ache or a day of low energy can suddenly feel alarming simply because the mind has been primed to expect danger. From a medical perspective, this kind of stress does not help the body. Elevated stress hormones can weaken immune responses, raise blood pressure, and make memory feel less reliable. In older adults, emotional strain often shows up physically, even when there is no underlying illness. This is why how we receive information matters just as much as what the information says. Staying informed should feel steady and supportive. It means choosing sources that explain rather than alarm and allowing information to come at a pace the mind can absorb. When learning feels calm, understanding settles naturally. The body relaxes, and progression is easier to interpret without fear. This is the reason Senior Health Daily exists. The goal is not to react to every headline, but to place health topics into perspective. When information is shared with patience and respect, it becomes a source of reassurance rather than stress. Many seniors tell me they find comfort in returning to familiar voices and clear explanations. That consistency supports emotional balance. I'm Dr. Evelyn Carter from Senior Health Daily. If this video has helped you better understand your health, please consider subscribing, liking, and sharing Senior Health Daily. Your support truly encourages us to continue creating calm, helpful, and trustworthy health content made especially for you. I want to emphasize that you do not need to follow every update or monitor every sensation to take good care of yourself. Awareness is not the same as vigilance. It is about understanding what matters and letting go of what does not. When seniors feel emotionally safe, their bodies respond with steadier breathing, better sleep, and clearer thinking. Information, when offered calmly, can support that safety. By choosing thoughtful sources and giving yourself permission to step back from constant updates, you protect not only your peace of mind, but your overall health. Staying informed should help you live your life with confidence, not keep you on edge. When knowledge is paired with calm, it becomes one of the strongest supports for healthy aging. Daily routines that help track meaningful changes. One of the most gentle and effective tools we have for understanding progression is routine. Not rigid routine, but familiar rhythms that give the day a shape. For seniors, routine does more than organize time. It creates a quiet reference point that helps the body and mind notice what truly matters without constant worry. When days have a familiar flow, small changes stand out naturally. Waking at a similar time, preparing meals in a usual way, taking regular walks, or enjoying a favorite afternoon activity all provide a baseline. Against that baseline, meaningful changes become clearer. You notice if energy is lower than usual for several days, if balance feels different during a regular walk, or if concentration shifts during a familiar task. These observations come calmly without searching for symptoms. In my clinical experience, seniors who maintain steady routines often describe feeling more in control of their health. They are not scanning their bodies all day. They are living their lives. And because they are not constantly monitoring, they are more accurate when they do notice something different. The change feels real, not imagined. Routine also protects emotional health. When the mind knows what to expect, it relaxes. Anxiety has less space to grow. This matters because worry itself can create physical sensations that mimic illness. Restlessness, tension, and fatigue often soften when daily rhythms are steady. The body responds well to predictability, especially as we age. Another important benefit of routine is communication. When seniors can say, "This is different from my usual day," doctors understand immediately. That comparison is far more helpful than listing isolated symptoms. It gives context. It tells us whether a change is brief or persistent, mild or disruptive. Routine turns vague concern into clear information. For those living alone, routine also supports independence and dignity. It builds confidence in daily abilities and reduces the feeling of uncertainty. When routines are in place, seniors are less likely to feel overwhelmed by health news because their own daily experience remains stable. Caregivers can use routine in the same gentle way. Observing how a loved one moves through familiar activities often reveals more than direct questioning. Changes in participation, timing, or enjoyment can signal shifts that deserve attention without creating distress. Routine does not mean ignoring change. It means giving change a calm frame. It allows progression to be noticed as part of a larger picture rather than as an emergency. This approach respects the body's pace and supports thoughtful decision-making. By trusting routine, seniors can stay engaged in life while remaining aware of their health. That balance is powerful. It replaces constant vigilance with quiet confidence, allowing awareness to unfold naturally, one familiar day at a time. Progression awareness in dementia and memory care. When memory changes are part of a loved one's life, awareness of progression must be handled with extra care. In dementia and memory care, the goal is not only to notice changes, but to protect emotional safety at the same time. This balance is something caregivers often struggle with, and it deserves gentle guidance. From my years working alongside families, I have learned that progression in memory conditions is rarely revealed through dramatic moments. It shows itself quietly in daily life. A familiar task takes a little longer, words come more slowly, interest in a favorite activity fades for a day or two. These changes can feel alarming if they are watched with fear. They feel manageable when they are observed with patience. Caregivers often worry that they might miss something important. In truth, you are already doing the most important work simply by being present. Consistency allows you to notice what is truly different versus what is part of the person's usual pattern. A sudden change that persists and interferes with comfort or safety stands out clearly when days are otherwise familiar. Protecting emotional safety means avoiding constant correction or questioning. Repeatedly asking how someone feels or pointing out every change can increase confusion and distress. I often encourage caregivers to observe quietly first. Notice how your loved one moves through meals, conversations, and rest. Let the day unfold naturally. Patterns reveal themselves without pressure. When a change does need attention, calm communication matters. Simple reassurance, a gentle tone, and familiar words help keep the nervous system settled. Even when memory is impaired, emotional awareness often remains strong. A calm presence communicates safety more effectively than explanations ever could. From a medical standpoint, progression in dementia is assessed through function and comfort, not isolated behaviors. Doctors want to know whether the person is eating, sleeping, moving safely, and feeling emotionally supported. Your observations of daily life provide invaluable information. You do not need to diagnose or interpret. Sharing what you notice is enough. It is also important to remember that stress in caregivers can influence the environment. When caregivers feel anxious, that tension is often sensed by the person with memory loss. When caregivers feel steady, the entire atmosphere softens. This steadiness supports better behavior, clearer moments, and greater comfort for everyone involved. Progression awareness in memory care is not about watching closely every minute. It is about staying gently attuned while allowing life to remain as normal and dignified as possible. This approach honors both the person receiving care and the person giving it. By observing with compassion rather than fear, caregivers become a source of stability. That stability is one of the most powerful forms of care there is. The role of medical systems and monitoring. One of the most important things I want older adults to understand is this. You are not responsible for tracking progression on your own. That burden does not belong to you. Modern medical care is built around quiet monitoring systems and trained professionals whose role is to watch patterns long before they become problems. In everyday practice, physicians, nurses, and public health professionals are constantly observing trends. This happens through routine visits, lab work when appropriate, community reporting, and ongoing research. Much of this work is invisible to patients, which is actually a sign that the system is functioning as it should. When care is quiet, it means nothing urgent is unfolding. I have met many seniors who felt they needed to stay alert at all times, as if missing a detail could place them at risk. That belief often comes from hearing stories that emphasize individual responsibility without explaining the support already in place. In reality, healthcare systems are designed to notice progression through data, experience, and coordinated observation, not through constant self-monitoring. Doctors rely on established pathways. We compare changes across populations, not just individuals. We look at timing, frequency, and severity in ways that no single person could do alone. This collective monitoring allows early signals to be recognized calmly and addressed appropriately. Seniors benefit from this layered protection without having to think about it daily. For older adults, this means your role is simpler than you might expect. Live your life, maintain routines, attend regular appointments, share concerns when something feels truly different from your usual pattern. That is enough. You do not need to track timelines, read constant updates, or analyze symptoms in isolation. Caregivers often feel this responsibility even more strongly. I want to reassure you as well. You are not expected to replace medical systems. Your observations are valuable, but they are part of a larger network of care. When you share what you notice with a healthcare provider, that information is placed into a much wider context. Public health monitoring works quietly in the background. When something requires attention, guidance becomes clear and specific. Until then, silence is not neglect. It is stability. Understanding this can bring a deep sense of relief. It allows seniors and caregivers to release the pressure of constant vigilance. Trusting medical systems is not passive. It is a wise partnership that protects dignity and emotional health. You are supported, even when you are not thinking about it. That support allows you to focus on living well today, knowing that professionals are already watching over what matters most. Trusting the body while staying engaged in life. As we come to the heart of this discussion, I want to return to something deeply important. Understanding progression is meant to expand your confidence, not shrink your life. Awareness should open doors, not quietly close them. Over the years, I have seen how easily seniors can begin to pull back once health becomes a frequent topic. Walks become shorter. Social plans are postponed. Daily activities feel risky instead of familiar. This often happens not because the body is failing, but because trust in the body has been replaced by caution. My role as a physician has often been to help restore that trust. The body, even as it ages, carries remarkable wisdom. It communicates through patterns, not sudden surprises. When you understand that progression unfolds gradually and is observed carefully by professionals, you no longer need to treat every sensation as a warning. You can listen without fear. That listening builds confidence. Staying engaged in life supports health in powerful ways. Movement keeps joints flexible and balance steady. Social connection strengthens mood and cognitive resilience. Purpose gives structure to the day. None of these should be sacrificed in the name of caution. In fact, they are part of what helps the body respond well to change. From a medical standpoint, activity and routine often provide clearer information than rest alone. When you remain engaged, you notice meaningful changes naturally. You recognize what feels different from your usual rhythm. That awareness is grounded, not anxious. I often tell patients that independence is not the absence of change. It is the ability to adapt calmly. When seniors trust their bodies, they are more likely to respond appropriately if something truly needs attention. They seek guidance without panic and accept support without feeling diminished. For caregivers, encouraging engagement is an act of respect. It affirms that the person you care for is still living a full life, not waiting for something to happen. That mindset protects dignity and emotional well-being for everyone involved. Understanding progression gives you freedom. It allows you to move through your days with steadiness instead of restraint. You can enjoy familiar activities, make plans, and stay curious about life, knowing that awareness and support are already in place. Trusting the body does not mean ignoring change. It means meeting change with calm confidence. When seniors live this way, health becomes part of life, not the center of it. And that balance is one of the most powerful foundations for aging well. As we come to the end of this conversation, I want to slow everything down and simply thank you for staying with me. Taking the time to listen and understand is already enough for today. Learning about the Nipah virus progression timeline is not meant to create fear. It is meant to restore balance. When we understand how doctors observe change calmly and carefully, the mind no longer has to fill the silence with worry. For older adults, there is no need to change how you live or remain on constant alert. Your body responds best to steadiness. Familiar routines, gentle movement, nourishing meals, and emotional safety do far more for your health than vigilance ever could. The body is not asking to be watched closely. It is asking to be respected and supported. I want to speak directly to those of you who care for someone with memory changes. Your calm presence matters more than you may realize. Quiet observation, patience, and reassurance are powerful forms of protection. You do not need to correct every moment or anticipate every change. Being steady and kind creates an environment where both you and your loved one can breathe more easily. If health information ever feels overwhelming, remember that you are not meant to carry it alone. You are supported by medical systems, by professionals who monitor carefully, and by communities built on shared care. Most of all, you are allowed to move at your own pace. Senior Health Daily is here to be a quiet and reliable place you can return to whenever questions arise. There is no rush to understand everything at once. You are not behind, and you are not alone. We will continue to walk through these conversations together, calmly and with care, one thoughtful step at a time.